Tell me, if somebody has a stroke, and it's an ischemic stroke, and they've identified everything, they've identified the patient, he's come there quickly, he's been within 6 or 10 hours, and they ask you to come in and look and see if maybe the clot can be removed. Tell me about what's going on.
Sure. So when the patient arrives to the emergency room, we get a scan to look at the blood vessels, a special type of scan where we give dye into the vein and we see where the artery is blocked or not. And once we've identified that it's a large vessel in the brain that's blocked, that sort of triggers our team to move forward and try to get the blockage out.
So if it is a large vessel, then that's the time where you come into the picture more so than if it's a small vessel.
Correct.
But is a large vessel likely to give more symptoms because it takes away more blood supply?
Absolutely. So we're talking about the main arteries that feed either the front of the brain or the back of the brain. And if one of those are blocked, then patients tend to be very symptomatic. And it's clinically identifiable, but imaging helps to clinch the diagnosis. And so once we've done that, then we bring our team in, and that's when we do a procedure or move forward with planning to do a procedure called a cerebral angiogram with thrombectomy.
Cerebral angiogram, so that's a brain blood vessel study in removing the thrombus or the clot that's there.
Correct. So what we do is frequently the patients are put to sleep with anesthesiology. It generally makes the patient more comfortable and able to stay still for us. In many cases when patients are having a stroke, particularly on the left side of the brain, they have a very hard time following commands. And so going to sleep helps us to keep the patient still, and it helps to make it a safer procedure. We use the arteries as a pathway to get to the brain by accessing the artery generally in the leg, sometimes in the arm. We can navigate a catheter, which is like a long, thin straw, and we can navigate that up to the blood vessels of the brain. And from there, we inject X-ray dye, take pictures with X-rays to confirm that the artery is either blocked or not. And once we've confirmed that the artery is blocked, using that method, we use that as a map to drive smaller catheters, some of them not much bigger than a few human hairs, into the blood vessel of the brain to then proceed with trying to extract the blood clot.